I'm Charlotte Stilwell. I'm a specialist prosthodontist. I work in a multidisciplinary clinic in Harley Street with quite a number of other ITI fellows as well. Amongst those, Shakil Shaddad, and Emily mentioned him before. I've had a very informal type of path. I'm in my 39th year of dentistry. I came from Denmark. I had to, for various registration reasons, start out in hospital. And I suppose the red thread has been my deep interest in removable prosthodontics. So that took me to a removable pros department at the Royal London. Thereafter, children came along, 2 of them, and I worked in general practice for 10 years, but kept up this interest in general, in removable pros. So that took me into specialist practice about 25, 26 years ago. And through the removable pros, eventually, of course, I also encountered implants.
Amazing. And you've done so much for the ITI, not just globally, obviously you've got these amazing roles, but even for the UK, you know, I mean, personally, you've kind of forged this pathway where, you know, people could do this 1-year FID training program, and then like myself, move on to have an MSc program where you take a year off as well. So there's a lot of work that you've done behind the scenes for the country. What, you know, to be Charlotte Stilwell and to kind of do what you're doing, what personality traits do you think you've got that have led you here? Have you always been like a really driven person? Have you always known that you wanted to do what you're doing now, or has it been
I'm sure people would say I'm driven, otherwise I dare say I would do as much as I do. No, I think, Depeche, I've always followed what really interested me. And so there are aspects of dentistry, medical legal reports, for instance, that's not really me. But there are other things like when I became involved in the ITI, and I was invited to be a speaker, and that's back in 2005. And I suddenly thought, education? Well, I mean, then that was interesting. You know, there was a spark there. And it was kind of a fortuitous time because it was just when the training standards were introduced. So there was a kind of blueprint, you know, it said what a structured education program should look like. And of course, the great thing about the ITI, whether you're at local level or international level, it's a team. And so there you had all this expertise. All you had to have was someone who was mad keen to get everyone together, organize, use all their expertise, their knowledge, their background, you know, be that in teaching, be that in mentoring, be that in their knowledge, you know, in the discipline or whatever it might be. We put together this program that absolutely matched the foundation implant dentistry program, that absolutely matched what the training standards were asking for, not just in the structured course, but in the mentoring program, in the training of our dental team members as well. You know, that then complete package, and also this flexibility that through approved prior learning one could go on to take a university MSc afterwards, so that it wasn't just a year that you might do, it was actually possible to lead to something else.
Amazing. And so I think not everybody will know this, but you're not really kind of interested in surgery that much, and you don't really place many implants. Could you kind of summarize kind of how you do kind of encounter implants in your day-to-day practice then?
Yes, I have 2 children. I place 2 implants, that's enough. And I placed 1 implant in a heel site and 1 in a recently healed site. And I thought, that's enough. Now I know all about that. I think I just did not have that strong surgical background. It was partly a thing in my undergraduate years in Denmark, where there just weren't that many teeth to take out, and we were struggling to find the wisdom teeth as well for some reason. So I didn't have a lot of surgical experience, so I did not feel comfortable about that. But I loved the workup for, you know, the restorative workup, and I love saying, I want it there. It's got to be like that. No, I'm not the one who's going to have to do it, but I'm very good at criticizing it if it's not right. And I suppose I just stuck with that, and that is, of course, possible in implant dentistry to do that. And what I suppose what I really enjoy in implant dentistry is that I enjoy doing all of it, not just one type, but you know, the single implant right up to something at the very far end, and also both fixed and removable.
Amazing. And for you, I mean, ignoring this kind of last few years of being a whirlwind, What do you feel like implant dentistry has contributed to your career? Do you feel like it's more valuable because you're part of it, or?
I think Angela said it in the opening comment. I don't think you can be a specialist prosthodontist now, actually almost even in general practice, without having a certain knowledge of implants, because that is one of the treatment options that you've got. Even if you don't undertake it yourself, you've got to know enough about it to give the patient a fair shot at deciding whether they'd like to explore it further. I mean, all the options apply in a patient-centered approach and to care. It isn't going to be an implant every time, but of course there are instances where it should be, just as there are instances where the partial denture, it should be that, or you leave a space. But we've got to feel, if we're working with patients in a patient-centered way, that we can advise and give them information in an objective way that allows them to decide what's right for them. Amazing. And I think implant dentistry, you have to do it. Yeah. You have to be involved in some way or other. You have to at least be comfortable around implants and know enough to be able to put the patient on the right track.
And I mean, I totally agree with every word you've said there. With implant dentistry, you've obviously been doing this for a little while now, and training, from hearing about everybody else's training pathway, things are, you can hear how everybody's had a totally different and varied and interesting route of getting here. If you were starting again, what do you think you would do? What would Charlotte Stilwell, if she was starting out again, knowing everything you know, what route would you take?
Oh, Charlotte Stilwell would take that whole program that she's been part of putting together.
Yeah.
And today it's called the ITI curriculum. And the ITI curriculum is backed by the ITI Academy with all the learning resources that you need. It's been countless hours of putting this together. But all that was not there when I started out, because I had a really painful beginning. I honestly thought if I looked at an implant, it fell out. This is back in the mid-90s. It wasn't implants that I'd been involved in having placed, but implants I came across in a job I started in 95. I mean, honestly, screws broke and implants fell out. It was a steep learning curve. And then it was so completely different when I started on cases carefully planned from the beginning at straightforward level. But the kind of textbook, all that stuff that you need to know, all the refreshers that you need in many other areas, it wasn't there. But now it is. Now we have it.
Amazing. And I guess a little bit of a different question for you. What have you taken away from tonight, hearing tonight's speakers? Everybody who's listening and all the delegates are going to take away slightly different things. What have you taken away from tonight's discussions?
I've certainly taken away from this that we have so many women who are now coming into implant dentistry, and we've just got to make ourselves, I think, more visible, and we've got to encourage others, because it is a fact that we are followed by hordes of women coming in to implant, or not just to implant dentistry, but to dentistry in general. And our patients are having lots of implants placed the world over, and we are the main workforce who are going to have to look after these. So it's really important that not just are we actively involved, but we also encourage everyone else to come in and to feel comfortable undertaking routine assessment and management as well. This is really, really important. And I think then, I suppose, don't forget your basic surgical skills, and don't forget your basic prosthodontic skills, because if, as we've talked about, you want to take up implant dentistry, those two areas, minor oral surgery and routine prosthodontic procedures, they're actually quite critical for being involved actively.